Osteopathy and craniosacral therapy for babies. In this video, we're going to talk about treating the head when the baby doesn't want you to. Particularly important if babies are this kind of age, 14 months old, and they don't like you touching their head. They'll pull your hands off. You can see from the video that we need to set things up with toys, but even if we set things up perfectly as we've done here, what you can often find is problems. And when we get the hands on the cranium, you can see that baby's bouncing. They're not happy, squirming around. They're showing a clear no with their movement and with their actions. So what are we going to do about this? Well, there's distractions and there's transitions, and I've talked about that in another video here. But here I want to focus on the actual techniques of what you do with your hands. But of course, to say it's just your hands is not true, because it's your whole body, how quiet and still you can be. But despite that, even when you can become incredibly still, often children don't like you touching their head. So the actual technique that I use to get around this is to hover just over their head. Now, I've come a long way off here in the video, and we'll come on to that and why I do that in a minute. But the point here is if you don't touch their head, then obviously the child is going to be far more accepting of that, and they may not notice you being there. Now, the problem, of course, with not touching your head is the obvious question, well, how can we treat someone if we're not touching them? And there's a simple answer to that and a more complex answer to that. So let's deal with a simple answer first, and that is you aren't going to treat that. What you're going to do is use this as a technique to be able to get your hands closer and closer and closer to baby until you can contact baby's head. Because what happens is human beings are aware of the people coming into their field. Babies especially are really true for them. And so if you close that gap, that physical distance to touch too quickly, then you will upset them. And so a way of getting around that is to be quite a long way off, sometimes even a really long way, and then slowly start to close that until you're able to make contact with baby's head. So that's a good way of starting with this particular technique. And if the parents ask you, well, why aren't you touching your head? You simply explain that. Well, I'm off the skull so that baby gets comfortable with me so we can get to the skull. So that's how I started treating off the cranium. And I suggest that's how you start as well. So you're able to close the gap and baby is comfortable with you getting the contact with the cranium. But what I also found was as I started to work like this with really sensitive babies, where every time I tried to close the gap, even expended time staying off the skull and then trying to close the gap, babies wouldn't like it. And so I would stay off the skull. Maybe I'd have one hand on the sacrum or someone else on the body and one hand off the skull. And then after an extended period of that, baby seemed to settle and baby seemed to change. And so there was seemingly something effective that was going on there, even without touch. Now, are we going to say what that is and make huge claims? No. All I'm saying here is there's two parts to this. The first part is being off the cranium in order to get touch. And the second one is staying off the cranium altogether for an extended period and seeing what that gives you. And if that gives you a greater insight into treating this person and a greater change than what you're getting when you're trying to touch the cranium and all they're doing is rejecting it and pulling your hands off. So I really want to emphasize I'm not making any claims for this. This is a tutorial and I'm simply presenting a tool, a way of working that I have found is effective for me overall in the treatment of babies. And so I would say to you, give it a go, because that's where the evidence is. If you start doing this and you find overall babies settle and you get better treatment, then great, include it in what you do. If it doesn't work for you, throw it out. And that's the key to honing your technique and improving your ability to help these babies. Hope that's of use to you. For more material, see the playlist here on treating babies or the link description to all of the courses in Kindred Academies that include courses for complete beginners right the way through to experienced practitioners.